Welcome to Google Cloud Next Healthcare Breakout. I'm Aashima Gupta. I lead our healthcare efforts globally. Been in the company 9 years, built the vertical from ground up. So a big note of gratitude and thank you for being in this journey with us. We have an incredible panel and leaders joining me today where we will be discussing the journey from pilot purgatory to actually scale, the lessons learned from the trenches. But before that, I want to share some of the trends that we are seeing in the industry, and some of them will resonate with you, others may be new. So we'll look forward to getting some signals as we share some of these trends. So this is how we'll spend our time together. 10, 12 minutes of a presentation, 35 minutes, and the panel discussion. Sounds good? Okay, so before I go dive into that, show of hands, how many provider systems in the house? Health systems. Payers? Health tech innovators? Great, it's a good mix. So healthcare has always been, I joined Google, I was with Kaiser Permanente, and healthcare has always been a complex industry. Complex not because it lacks technology or we are technology laggard. It's because at the end, healthcare is deeply human. At the end, it's a patient, it's a caregiver, it's a clinician looking into better ways to manage, navigate, help their patients. And this moment is different. How, agentic transformation, how many of you have heard this phrase and have built system in the past? What is different for me as someone who's come from the industry is we used to bring technology into the already complex landscape of healthcare IT. That meant building a point solution here, getting a workflow automation tool there, and at the end, we layered solution on the top of complexity that already exists. This layer is different because now AI agent software technology is able to reason, it's able to adapt, it is able to live within the flow of work. And we believe this moment of agentic transformation will reshape how we all experience healthcare, how clinicians, nurses will deliver care, how your back office, front office all will experience and deliver on their mandate. These are the 5 trends that, and I'll cover each one of them in detail, where we believe the manifestation of agentic enterprise in healthcare will take shape. Let's take the first one, which is empowering individuals to peak productivity, meaning each of your employee will have a personal agent. There's always a chore of the job, and there is a purpose of the job. In all fields within your enterprise, from software engineering to nurses, clinicians, to back office, all of us, me included, will have an agent to guide that, to restore the purpose. The second trend we see is agent for every workflow. Healthcare workflows are long running. They are also multi-step, there are dependencies, there's handoffs. We believe agents can stitch these different disparate tasks together, and we are seeing the trend of every workflow being reimagined with agents. Third is agent for every patient, to remind, to advocate for themselves, to navigate care. Healthcare is hard, we all know that. We all have experience in our personal journeys. Fourth is around to make it all real. There is no agentic strategy without a security strategy. So agentic defense, you will see that come to fold and come to forefront as the agents become mainstream within the landscape. And finally, it is about people. People at the core of it, people at the core of transformation, and upskilling there. So let's take the first trend. We all know healthcare workers are not just physically tired, they're cognitive burden. And to me, if you see at this chart, we are building agents. We're bringing that into the workflow. And one of the big tasks, or one big trend we see, search and summarization as a common use case of documentation burden that exists today. But I believe it's not just in those clinical workflows. Every employee, I reiterate, be it a software engineer, be it a nurse, clinician, operator, they will all have a personal agent. So let me ask a question. How many of you have built an agent of your own? That's impressive. I think we're all going to go there. We will all have that personal agent. To ground us on, I said there's a task of the job and there's a chore of the job. So that's the administrative tasks that AI will take away, giving more space for judgment, for more empowerment, to really doing purposeful work. As I said, the data is supporting that. We're seeing those use cases come to life. The second is within the workflow. Healthcare doesn't break at the edges, it breaks at the workflow. These workflows are long running. Take something like prior authorization, eligibility verification. Healthcare specifically has long running dependencies, workflows, and agents at the middle of it. They can adopt, and they are living within the workflow. I think that's the difference between bringing a technology from the era past to the technology that is today. It's able to live. The intelligence is not separate. We are going to experience it within every single workflow. Our data confirms some of the work we are seeing is actually in those workflows. How many of you have deployed an agent in the workflow? Be it RCM, prior authorization, take any workflow. I think that process knowledge, that workflow knowledge is going to be as important as the technology, and agents are going to augment and live and reimagine the workflow from ground up. And by the way, it won't be just one agent. We envision a future of multi-agent enterprise where agents are doing these handoffs between different departments, different cross-functionally. In the recent survey we did, there are within the workflow 10 plus agents being deployed today. So this is not a distant future, this is happening right now. Well, now shift to the patient. Again, show of hands, how many of you are reimagining the patient or member journey with an agentic interface? I would love to see more hands go up, but it's understandable in the regulated industry, patient-facing innovation will take time. But this is where we are seeing 44% of healthcare stakeholders are really looking into guiding the patients. And we need to be careful here. It is not about replacing clinicians, replacing that judgment. It is about augmenting. Can there be a world where AI is assisting patients, again, with the chore of care navigation? As we build the system, appointment booking, checking my insurance coverage, checking which physicians takes my, what's my copay, things of that nature, we put all that burden onto the patients when they're in the most vulnerable moment in dealing with healthcare. This is the opportunity where AI can be that always-on, 24/7 concierge in helping them navigate, making space for human judgment, human touch point when they're actually needed. Then there's a clinician, there's a nurse right there. And that, to me, is a fundamental shift in how we should imagine patient experience, member experience as a combination of two, creating space for more meaningful, high-touch engagements as and when they are needed, but for the mundane tasks, for the navigation tasks, AI can be that 24/7, always-on concierge. And as we introduce agents into healthcare, the risk surface expands. You're not protecting data anymore. You're protecting the workflow, you're protecting the decision. At the end, you're protecting the outcomes, you're protecting your patients. I don't know how many of you saw the Francis D'Souza's cyber keynote this morning. we believe agentic defense is going to be in your vernacular if it's already not there. These attacks are getting sophisticated, and we need to build those defenses because these agents will be able to then reason, adapt, detect threat intelligence, and do it at scale. If you do not have a security strategy, I will tell you, you don't have an agentic strategy. And in our work with our acquisition with Wiz, there's a tremendous focus on AI security, and 49% of our customers, they have AI-based cybersecurity operations. If you don't have it, I would say I highly encourage you to walk the floor, get more first-hand knowledge about it. Agentic defense. And this final trend is not about technology. It is about people. Every organization who's doing an experimentation today with AI, we'll hear from our panelists, there's one common thing that makes it different from pilots to scale, and that's the people. AI literacy in every part of the organization is going to be critical, otherwise we will be stuck in the experimentation, you won't be able to scale. And this is AI literacy, not just, by the way, for your engineers or your data scientists. It's AI literacy in every role, to operate, to manage, to audit. And because adoption or with the diffusion of AI is not going to be, and it is not a technical problem by itself, it's a change management problem. It is a human at the other end. How are you equipping your workforce with that AI literacy? If you see this graph, there's a gap. 82% healthcare executives think AI literacy is important, yet only 30% feel there is a curriculum to lead them into this agentic era. Show of hands. How many of you have a AI literacy for every role in your organization? I think that's the gap. That's the worry I have. And this is where, when we think about going from a pilot to production to scale, you cannot have it without thinking about the people within it. And to me, you will hear from the panel as well, the biggest thing that you can do is make case for your management, whoever the powers to be, to make conscious budget investment in workforce upskilling. Now, this is my last slide. But if you look back, if you take a step back in those 5 trends I shared, agents for employees, to agents for patients, for every workflow, for security, for upskilling, there's one common thing. And the common thing is you cannot create more silos. They don't exist in isolation. You can't have agents. If you believe in the premise that every employee will have an agent, if you believe in the premise that every workflow will have an agent, if you believe in the premise that we will have security right at the core, the auditability, trust is the currency in healthcare. Healthcare does move at the speed of trust. And you can't have that with agents scattered across the organization, which are governed differently, which are secured differently, which are auditably different. And to me, that's where we will bring that complexity right back in if we don't be very thoughtful and intentional about it. We are very proud from Google perspective, Gemini Enterprise. Think of this as a system behind the system. A system to be able to create agent, to monitor agent, to operate agents with the right security, right guardrails, and doing it at scale. Because without this single pane of glass, my concern, or the concern we hear from the ecosystem also, is this will become unwieldy. I often used to give this example. How many apps do you think exist in different app stores? Any guess? Millions, right? There's an app for everything. How many of those apps meaningfully connect to patient data in an interoperable way? That percentage is very small. And I believe we'll create the similar, if we do not have a single cohesive system behind the system, we will complicate and we'll have thousands of agents, maybe even tens of thousands of agents without the security pane, without the control pane, and that's where the pilotitis happens. This is where pilot purgatory happens, and again, it'll take all of us working together to build assistance. So with that, now let's move on to my favorite part of this session. I will invite my fellow panelists to join me on stage, and we'll delve into some discussion. Right. Thank you. All right, please join me in giving a round of applause to our panelists. So my first question will be, could you please each introduce yourself, your name, your title, and how you're working with us on AI initiatives. So Nishant, I'll start with you.
Can you guys hear me?
Yep.
Okay, hey. I'm Nishant Usapkar. I manage the AI engineering teams at HCA Healthcare. We use Google extensively for our AI stack as well as the data stack. So our Gen AI, traditional AI, primarily runs on Google stack.
Thank you.
Hello, everyone. Good morning. Good morning. I'm trying to wake everyone up in case you guys are easing into a cold conversation. We would like to make this a little peppy. My name is Sushma Akunuru. I'm the CIO at a company called Independence Blue Cross. If you've seen the Blue Cross, it's not synonymous to Blue Cross Blue Shield Association. It's one of the many licensees. We are a Philadelphia-based organization. The family of companies at Independence serves more than 6 million members with the single mission that we would love to enhance the health and well-being of the more than 6 million members that we serve. And more importantly, I want one thing to be a takeaway. The goal of the CIO at Independence is to use technology to change the way we think from a consumer standpoint about what healthcare should mean to us 5 years from now. So that's my key takeaway from this session. Hopefully with partners like Google, we will sort of design a plan and we will be able to execute on that.
I always say it takes an ecosystem.
Hi, Madhu Narasimhan. I am the Chief Information Officer at DaVita. We are a global kidney care company. We operate in 14 countries. And we take care of patients starting with early onset kidney disease through transplant. In terms of Google, we are close partners, so we have the entire Google stack. We built on GCP, and we have all of the data and AI tools as well. And our focus is, similar to what Sushma says, technology with intention. So we focus on what we are trying to get done, and that's how we look at technology.
Thank you for being here.
Hi, everyone. This is Maddy. I lead AI for Elevance Health. And we are in the midst of a huge transformational journey. We're doing business transformation. We're doing process transformation. We're doing technology transformation across the board. And for those of you who don't know Elevance Health, if you resonate with Anthem Healthcare, and that's what it is. And with that, all these transformation with technology being at the center, we are partnering with Google, and Google is accelerating our agentic AI journey in various ecosystems that we operate in. And some of the examples that I can briefly quote is we are reimagining an conversational experience for our associates and our members and our providers to engage with us much more seamlessly. This is going to be really big. We are in the pilot phase for this, but it's going to be huge for us in reducing our administrative friction that we have, reduce time to engage with our members or our providers. Thank you.
Well, thank you. Well, with that, let's dive right in. Our first theme of the panel was pilot purgatory. How many of you are running pilots but are not able to scale? Just rest everyone is scaling? Okay, great. So, Sushma, I'll begin with you. We all have seen great demos, great promise, incredible tech, good use case. And then what was in your mind internally, what is that inflection point where it becomes from pilot? What one decision, or maybe it's not one, maybe there are many, what is that inflection point where you saw the scale happen in your experience?
Yeah, I think in the last couple of years, it was natural for us to not just react to a shift in a couple of paradigms. And I want to touch on that a little bit. Healthcare, as you all know, highly regulated. We have mandates to follow. We have to be compliant. But in the past, to some extent, we were sort of checking the box and doing the minimum. That shift from the top, from the government, for us to be able to deliver on that, or we either lose business, we lose revenue, or we are really penalized for non-compliance, is really coming to a very tight closure. So there's no room for us to sort of defer some of these experiments to sort of say, we'll do the bare minimum now, but we'll double down in future. We got to act on it today. That's one. Two, consumer expectations, right? I always relate to, as a consumer of healthcare myself, the expectation is real-time insights, actionable, next best actions for me to act on. I want actions to be almost driving the next best opportunity as a consumer, as an individual, as well as an organization. So you do not have the opportunity to sort of say, well, we had batch jobs in the past, or another one more year of curating our information, and then we will experiment on AI. That phase has been passed, so we've crossed that hump a little bit. And the third thing I would say is just think about some of the absolute requirements from whether it's prior authorization acceleration, access to care requirements, right? All of these costed money in the past. So we sort of were keeping that away in terms of we will address them when there is a pure business case. But now the business case is, wait a minute, you got to do all of that, but you also have to do it much efficiently and faster for less. So cost pressures in healthcare, and then you add these two other layers of sort of paradigm shifts. I think there's no better time to act on it now. Well, you put Google Cloud and Google's sort of all of the amazing capabilities we saw this morning on top of that, you are enabling change. So why not now, right? So I think 2025 was a year of experiments. I personally think 26 and 27 will be an absolute 2-year of action.
That's a great, Aparna. The sense of urgency, the tying it to business outcomes, this is where technology, not for the tech's sake, but actually tied to business. Nishant, how's HCA thinking about it? We first worked on it a couple of years ago, you're scaling it. How are you, when you think about scale at the HCA level, 190 plus hospitals, what has been your learning in scaling that?
Sure. As you mentioned, we operate close to 190 hospitals. That adds a level of complexity, which is a lot. What we ran into, like we've been doing this AI transformation for a few years now. What we used to run into previously is this one-off fragmented use cases, not delivering real value, and most importantly, not tied to the workflow, right, which you alluded to earlier. Like our clinicians and staff are already stretched, and they don't like to use any tool which will add more friction. That's kind of one of the biggest learning for us. So we had to go back and rethink on how we deliver our projects. So we basically transformed, instead of thinking in terms of use cases, HCA Healthcare is now thinking in terms of domains. So we formed like core domains for each area of our hospital transformations. Like we have a domain for, let's say, clinical AI. We have a domain for our back office, like revenue cycle, supply chain. We have a domain specifically for our nursing staff, right? And then instead of looking at each use case, we see how can we add value at various layers within the domain. So all our goals, and even we have a very cross-functional team at the domain layer. Like we have a process engineering team who will work with our users, frontline staff, from the get-go to understand how to build the right solution. We also have change management team, which comes in later on, tries to like talk about the AI literacy, get real feedback from the users. And that has really helped us scale, because end of the day, when you're trying to scale to 190 hospitals, it's less about the innovation, and it's more about the execution, right? People don't really care about the novelty at that time. It's more about the ease of use.
I couldn't agree more. It's going to be about diffusion and change management. So Madhu, which brings me to you. Healthcare, we always, there's a perfection and you have to move fast. There's a sense of urgency, paradigm shift Aparna talked about. In your role as a CIO of Davita, with a very similar scale, how are you balancing those two?
Yeah, innovation versus security. The truth is, it's a false choice, right? Healthcare doesn't have the option of choosing one or the other. And that's why it's regulated for a reason. Unlike retail or even banking, you can't like return something or turn back a transaction. It's done, it's done. So, but I do think there are a couple of things I'd say, and both Sushma and Nishant have covered it. One is understanding the intent of what we're trying to do. So there's this thing we talk about, which is technology with intention. There's a lot of technology.
Yeah.
But what do we use it for? So our fixation is on the best patient outcomes, caring for our caregivers so they can care for the patients, and how do we make sure that all of our teammates, our employees, have the least friction in their administrative days so they can focus on what they do best. So that's kind of like the philosophy principle in aligning to the strategy. And then what we look at is, what do we bring in quickly? So there'll be uneven adoption. In the back office areas, it'll be faster because it's possible to get more deterministic outcomes. In the clinical space, it takes a little longer. But we've had really good luck with clinical summarization, some of our even clinical dosing, some of the patient behaviors, because we are very intentional about what we go after. And that allows for that innovation to go at pace, because people understand the value, and that includes our clinicians as well as our caregivers. So that's how we've handled it.
So starting with intention, starting with the AI strategy at the top, just show of hands, how many of you feel that there's an AI strategy set at the top of your organization that you're executing against? I think to me that's again an opportunity for the industry, kind of take away. And coming back to you, Maddy, how are you, like elements with the video scale, speed of innovation that is required, need for the strategy, intent, as Madhu talked about, how is Elements thinking about it?
Yeah, so, yeah. So I think to what Madhu was also mentioning, I think in healthcare, rigor and speed are really super critical. One way or the other, I think you need both. I think it's the way we are trying to look at this strategy and balancing this is by looking at areas and clearly delineating areas that can move faster and areas which require to be taken into look. We need to look at it much more carefully. And wherever we're looking at it, like if it is a clinical thing, I think we need a much more solid rigor in this. But if it is much more administrative tasks that we are trying to streamline, and that's something where you can slightly go off of some rigor. But how do we do this is where we were thinking, like, how do we reimagine this if we have to really move fast in certain areas that we could? And technology is the only solve, right? So looking at it, the way we were looking at our strategy is looking at building reusable, capabilities on AI, and which is specifically coming to healthcare. Think about it. We deal with a lot of documents. We deal with a lot of process workflows, as Aashima was mentioning in our earlier slides. We have a lot of data. So we need intelligence built around all these things. So we have started building our document intelligence platform and framework. We have workflow intelligence platform and framework. We are building on data intelligence platform and framework. We have voice intelligence platform and framework that we are continuing to look at. We are looking at SDLC intelligence for improving and the efficiency and productivity of our associates, internal associates as well. So that is one in terms of building the frameworks. But it doesn't go far if we don't apply governance to it. So reimagine this, all these frameworks that we are building comes with built-in governance, comes with explainability, comes with observability, comes with fairness, right? Looking at that, if you bundle all these things together, you significantly reduce a lot of governance time over a period of time, which we, like an year or two back, if you were to ask me, I think we were like struggling with it. We had about 70 plus people on our governance meetings to go through. So it takes a lot of time, and it's for the good reason, right? And that's why sometimes people still see that we are slow in healthcare, but for a reason. But we are reimagining all that and taking that to a next level to see how we can look at fast-tracking some of these things.
I love the focus on repeatability, and there's tons of different use cases like RAG and auditability, observability. These are common across use cases. Nishant, coming to you, Aparna talked about starting with a business and outcomes. There's a lot of discussion about ROI, but ROI cannot just be in terms of dollars saved, or is it? Or is it more broader view? How, when you worked on the nurse handoff, like how do you think about ROI and as you strategize and scale it?
So at HCA Healthcare, our ROI, we have evolved past just thinking in terms of pure economics, right? We have a very elaborate OKR-based goals, which we take like every quarter. And most of the goals are around like trying to reduce the administrative burden of our healthcare employees, trying to make our workflows better, or more important, trying to improve the patient care. Finance and economic value is important, but if you do these things right, I think that financial value will follow. That's kind of our kind of overall, that's how we operate. One thing which is like very consistent, I talked about how we have these domains. We have a very consistent value tracking across these domains. So our domain leader, every quarter, we take on goals which maps or aligns with the value proposition for that domain. And our projects have very specific KRs that maps to the operational metrics or the outcomes, and we closely monitor that. And then end of quarter, the value tracking team will monitor our progress and then work with the finance team to understand the impact.
I think at your scale, thank you for sharing that. So the use case that we work with on HCA, it's nurse handoff. There's 60,000 handoffs in a given day across your hospitals. So even if you say 5 minutes, I always say it's 300,000 minutes of nurses you're saving. Just 5 minutes, which is a very conservative. And a minute saved and paperwork is a minute towards care delivery. But it's really refreshing that you're not just thinking in terms of, okay, I'm saving these many minutes. It's really about value engineering. In cloud also, we have this new discipline. We call it value engineering. And this is becoming, first and foremost, there's a whole way to look into value to have those kind of discussions. Aparna, same question to you. You talked about, the outcomes and the access. But at the end of the day, when you are going to your executives, how are they measuring the ROI? The question.
Sushma, and you
Oh,
called
sorry.
me Aparna twice,
Sorry.
so I'm just confused.
Okay, sorry, my bad. Sushma.
No worries. So I think, thank you. You seem to be the official reminder of everyone holding their mics close. I think it's important to kind of think about, as business leaders, or if you're a developer, you're a tester, you could be at any, position in the organization. We all have a responsibility to build our own business case. We sort of think of this as a finance exercise or a business. Who's the business leader? Who's the owner? And let them sort of construct it. I encourage my team, and I feel like we all have to shift away from that kind of a thought process. So it all begins with one example that comes to my mind. At Independence, many years ago, we built sort of tools and intelligence to find out care gaps, right? We mine all of our membership information, and we say, who are the members who are sicker, requiring more care and attention? We have all the data. Well, what do you do about it? Then we could have waited for the clinical team, right? The chief medical officer to come and suggest us, hey, now that you have all this information, here are 10 possibilities, either to turn that into actionable insights, and what do you do to now improve the health and well-being of the members? Or if you are the developer, you built that data, you pulled all of that information, you have the power now to sort of build that case. To Nishant, your point about not every ROI has to be quantitative and in the dollars. You have to build a case to say, if you harness the power of this gaps now, imagine if you can serve that in your member portal interactions with the members. Imagine the kind of satisfaction you would drive when members get to know, hey, I opened my mobile app, I was only checking my bill or my claim information, but wait a minute, I'm also reminded of my upcoming mammogram, right? I'm due for that particular procedure for 2 years. Or I was evading sort of doing some preventative care. Now imagine the downstream impacts and the benefits of that kind of input, but we just don't sort of look at it that way, right? We look at point solutions. Here's a care gap. Initial ask was, it came from the clinical team. So I think I would encourage, if you really want to see value, start with that one process or one activity and task, but also explode that. Almost like if you guys have sat through the keynote speech this morning, everything that Google is doing is connecting the dots, right? Put all the dots on the board and start connecting as to how the downstream, upstream connections work. I think there's powerful ROI right there. That's one of the philosophy. And the other thing I would say is, obviously start with where you can directly find a sponsor. Customer service, right? The most successful domain where AI was able to yield results is customer service. So if you can directly tie that to, hey, if we can automate, use voice agents, we avoid sort of the cost of expensive customer service professionals. That on paper it looks good and you can easily execute it this day and age. Start with those ideas, but then think about the power of, hey, we saw the example this morning, right? But, I forget the name of the individual, but the interaction in multilingual, cross-language conversation with the company being discussed. That's amazing, that's powerful. Now you start with you had a problem, you started with almost like an inquiry about a grievance or a complaint, or you have a task to do, but then it results in sort of cross-selling and revenue. So those are some ideas where you can actually build a holistic ROI case, and you don't need to be an expert for that. Copilot can help you, like Google Chat and Enterprise can help you build that.
Yeah, very well said. Connecting the dots, finding the sponsor, those areas. Shifting gears a little bit, Madhu, I'll ask you, there's no AI strategy, or maybe there's a very robust AI strategy, but data has to follow that. I often also say that you can't have an AI strategy if you don't have a data strategy. How are you thinking that in Davita's world?
Yeah, you're absolutely right. And healthcare being a long-term thing, we have a lot of legacy data in multiple systems. So we have had to put together a data strategy and figure out where we tackle first. So we make sure that, it's again with intent. Like, do we go after the patient data first, the clinician data? Like, how do we do that? The other thing is we have a little bit of focus on what is employee productivity, not necessarily going after our ROI. So you have a return on employee, and then you have a return on investment. And we try to keep those separate because we're willing to invest in the return on employee first, and then identify those areas like Sushma was just saying, where you have sponsors for the return on investment, so that we're also uplifting. So that's how we're looking at it, and so far it's working.
That's awesome. Maddy, any thoughts there? And then.
So, for most of you, I think all of you would nod your heads here, but in healthcare, data is a gold mine. And you need to govern that as well if you have to, and make it usable for the enterprise. So in our company, I think mostly the way we look at it is it's looking at structured data, a lot of unstructured data coming into play. A lot of data resides in unstructured formats, like it could be documents, it's in emails, it's in faxes, it's in images that comes into play. And it's all massive sets of documents. And for somebody human to take a look at it and go through it, it's going to take a lot of time. So for us, it is about how do we bring these unstructured data and structured data into an intelligence platform and make it accessible, usable, secured to the rest of the enterprise. I think that's how we are looking at, we are building those governance platforms on top of the structured data and as well as the unstructured data to make that happen.
All right, so we are 4 minutes, the last segment of the panel. I want each one of you to share, going into next 27, we're all sitting here. What is one thing you are incredibly hopeful for? It could be a use case, it could be you work from your organization. So Nishant, will start with you.
See, one of the success which we have seen recently in HCA Healthcare is our ambient documentation, where the interaction between the doctors and patient can be silently captured by an AI, and then eventually it generates a clinical note which the doctors can take a look and then submit it, right? So we are seeing some good adoption of those modalities. Like what I'm expecting, we can take it a bit further, just not this one patient-doctor encounter, and not just voice, but I'm pretty hopeful like in future, computer vision, voice, and that will help transform how we run some of the hospital operations, reduce the cognitive burden on our healthcare staff, as well as overall improve the healthcare delivery, right? We have done some initial work, but I think I'm hoping it can mature so we can start actually using it in a real world scenario.
That's great. Multimodal, I think if you've not given Gemini Live a try, definitely do that. Sushma, now to you, 2027, we are here. What are you most excited about?
Yeah, I envision that if I'm able to join Google Next again next year, which I would love to, I'm enjoying every bit of it already. So I hope I can proudly sit here and maybe with my team and some of my team members can be here talking about how at Independence, every employee has a personal, self-governing AI assistant that they can rely on. And when I say AI assistant, I'm not talking about an ability to go to a conversational AI and ask, hey, what do you think are my tasks today? And look at my calendar and tell me what I need to do. I'm talking, if you are an underwriter, I want to be able to come start my day with, hey, last night I scanned all of your activities or data, and I think here are 3 proposals I've already built for you, and leave my job to be the last lap reviewer. If I'm a marketing person, I want to log in for the day. In the morning, all I do is, hey, I've built 4 proposals for you to take a look, and I've scanned all of your information, and I'm preparing you. Your day's job should be condensed to 2 hours, and we spend the remaining 6 hours on something more healthy and fun. I think we can get there.
Yeah.
I think we're pretty close, but we need to plan for it, and to your point, execute faster.
That's a very powerful vision. And if you saw my first trend, also an agent for every employee, it's not just search and summarization. So thank you for saying that, Sushma. It's like, how is it coming into the context intuitively? Madhu, same question for you.
Yeah. In 27, what I'd like to see is a patient experience driven by an orchestration of agents, caregiver agents. That worked for me.
An agent for every patient. We all need that. Maddy, round us up.
So for me, I think we are doing a lot of pilots, and not just our company. I think pretty much most of the companies are doing a lot of pilots. I think the way I see 27 is a lot of these pilots getting embedded into the workflows. AI doesn't become just a tool, but AI is embedded capability into every company, every workflow, every process, focused on member outcomes or whoever your customers are. If the provider in the healthcare space, providers, brokers, members, our associates, I think it becomes so useful for them, eliminating friction in whatever they are seeing today. Yeah, that's.
Well, that rounds up our panels. Please join me in thanking our panelists.